Hello YouTube. This morning I went to a field trip about a medical campus and I was able to film. So hope you enjoy the clip that's about to roll. Hope you like, subscribe, and comment what's your favorite film, and please love it. And here is the clip.
cover a few of them today. But you know, the coolest thing that we offer here is our simulation hospital. It's about $48 million that was spent on it. So you're gonna be able to see mannequins that have seizures, heart attacks, give birth, a lot of cool stuff. And you know, I connect a lot with Ann and Sean and JD, and we want to make sure that you guys are supported. Okay, I'm here to support you guys. Anything you guys need, you're gonna have my contact information. If you need more information on our programs, reach out to me. Okay, but I'm excited to have you guys here. Not a lot of presentations gonna be done through me, but we're gonna be able to check out the different programs, and you're gonna be able to speak with faculty and different administration. Okay, so I'm excited you guys did this, and excited for you guys to be here. So I'm gonna give you guys my card. You guys can just pass it around. But just before we go, we start off in simulation. Tell me a little bit about yourselves. What are you guys interested in studying? Anybody? Nursing? Okay.
All of us
Nursing? Good, good. That's a great program we have here. We have our ASN program. That's probably the most popular program that we offer here. And now we just started our BSN online program. So as you complete the ASN program, you're able to go into the BSN online. And we were just talking, me and Louis, who's one of our media coordinators, they're hiring ASN students even before they complete the NCLEX. So it's incredible how much opportunity there is, especially with nursing. And here you're gonna get a lot of experience, and we have contracts to be able to do clinicals with Jackson, Mount Sinai, Baptist. We have the Baptist Scholarship. So we're gonna be able to connect you with you guys. And we have a faculty that's gonna speak with you about the nursing program. So we're excited to have you with that. Anybody else interested in a different program, or is all nursing?
Ultrasound.
Ultrasound, yes, good. We're gonna go see that.
I'm at Vet Tech.
Vet Tech, yes, that's a great program. Our faculty bring in the animals on campus, so you're able to work with that. So that's really cool.
Yeah.
What else? Anybody else?
Dental hygiene.
Dental hygiene, yes, good choice.
Pediatrics.
Pediatrics, nice. Yeah, we have a lot. All that stuff, you're gonna see a little bit of everything, okay? What else? So are you guys taking prerequisites now? You're taking, how you doing? You taking courses at Kendall? Okay, all right, cool. Have you guys taken the chemistries, the anatomies, whatnot? Okay, so in our program, something we like to emphasize is how do students get into these programs? Very simple. They're not gonna interview you. They're not looking to see if you have medical experience. They're not looking. They're gonna look at how you do in your prerequisites, these courses, especially the natural science courses. So it's important that you do well in your chemistries and your anatomies, because that's what they're looking at, especially for nursing. They're gonna look at three things: how you do in the prerequisites, how you do in the natural science courses, and how you do in the T's, okay? So I want you, now that you're at Kendall, I want you to focus on those classes and make sure you do well from the start, all right? And from there, we're gonna take care of you, all right? We meet us halfway, we'll do the rest, okay? Everybody was able to get my card and information? Sweet, sweet.
We're still missing.
Oh, still missing? All right. So I think we have enough to go as one group to simulation. So that'll be great. So we'll take them up to simulation. That's really, really cool. And you're gonna see a lot of things that are done there. All right, so we'll start off and then we'll take you up. Unfortunately, my dean, a few other directors are off campus today, but we'll make sure that we get an opportunity so you guys can meet them as well, all right? So let's go check out simulation. I prepared those bags for you.
Looking all the way here, looks like they're all like that, but then I think we are
Hi, how are you?
Hi.
Thanks for having us.
I love the interactions.
All right, so this is
our mannequin. His name is Hal. And this is the ICU room. So we have different types of rooms to simulate what it's like in the hospital. So we have med-surg, ICU, trauma, obstetrics or OB. We have an ambulance here. So I'm gonna show you all those shortly. But I just wanted to point out that we have a couple different ways of like showing what the mannequin is feeling like, because the mannequin can't really express themselves like we can. So we're showing their vitals up there on the screen. And the mannequin, we can do a bunch of different things with the mannequin. They're called high fidelity mannequins, so they're able to simulate real life at the highest level. So you can intubate the mannequin. The mannequin can talk to you. The mannequin blinks. It shows pupillary constriction and dilation. You can do a bunch of different nursing interventions. There's chest rise. You can do CPR. So there's a bunch of different things that you can do with these mannequins. We also have a crash cart. It's that red cart in there. So just like in the hospital, you'd have that crash cart in every single room. So in the simulation hospital, we try and mimic what the hospital is like and what the hospital environment is like, so that we can kind of recreate it to the best of our ability. So once students enter the clinical area, they know what's going on. Do you guys have any questions? No? All right, so this is Hal, and all the adult mannequins that we have here are named Hal, and this is a man right now, but we can also change it to a woman, just changing some of the parts on them. All right. Now I'm going to show you.
You can put a wig too.
Yeah, you can put a wig as well. You guys want to show them the ambulance?
Yeah, sure.
Yeah, so this is our ambulance. It is the same proportions as a regular ambulance that you would find in the street, and it is intended for all those that are trying to do EMT, paramedics, EMS in general, emergency medical services. So it's basically a recreation of what it would be like in the field when you're out there. The ambulance actually moves, so you can actually feel what it is. For example, if you're putting... You want the lights on? Oh, thank you. Yeah, so it has the light. It has also makes kind of a similar sound. And in there, as you can see, thank you, it has also compartments. It's just like a regular ambulance that you would see on the street. And it would have a paramedic, it would have a chief or a lieutenant sitting there, and it would have probably an EMT too, an emergency medical technician. So it's for them to practice and see how they're working. And even the stretcher is the same stretcher that you would use outside. Everything in the hospital is medical, in the simulation hospital, is medical grade equipment. It's the same thing that you would find in a hospital, in an ambulance, at fire stations, everything is the same. So yeah, we also have those boxes that they're the same ones that you would find out there too. They have, for example, equipment for intubation. They would have things for trauma, for pediatrics, for obstetrics. Sometimes women give birth in the ambulance. So you have to be ready for everything. So yeah, that's pretty much everything in the ambulance. We can move on to OB.
So this is our birthing mannequin, Victoria. So anything that has to do with obstetrics, she gives births. She does like the breech when the baby comes out the other way. And then on the side, you'll see the newborn. So that's after the baby's born, all the assessments that the nurses have to do, they'll do on that one over there. So.
Are we able to go inside?
No.
You can take a look.
You want them to? Yeah, why?
You can take a look.
So that baby usually moves, it blinks, it actually cries.
Does she tell contractions?
Yeah, actually, it'll usually display on the screen over here. So when she's having contraction, you'll see everything it'll go up. Yeah, if you want to you guys can actually touch the baby.
You can try on that area if you want.
So all that work is over.
Yeah, she blinks and everything.
And apply it. So they use their critical thinking skills. How are you doing, my girl?
Where's Dad?
Yes, he's coming soon. He's in the other room in ICU.
I want my milk!
She's in the OB room as well, but they're gonna come in and see you.
Who are you?
So as you know, this is very interactive. So we want the students to be immersed in the clinical scenario so they get the most of it. The faculty would send homework prior to the simulation day, so the students can be familiarized with the clinical scenario before coming in. When they come in, they'll go to the back of the room. Oh my God! Yeah, there's a sign on the wall.
The tears. Yeah. Come check out, Jason.
Oh my God! Take over the show.
He's crying.
Yeah, and he has facial expression. His pupils are reactive. He also has an auto eye track. The students can take blood pressure. They can listen to the heart sounds, lung sounds, bowel sounds. Also, they can do intubation, full insertion, nasogastric insertion. They can also practice CPR, and all the rooms, as you can see, are fully equipped. They have IV pumps, crash cards. We also have a software for patient charting that's called DocuCare, so the students can also practice entering all the patient's information in the laptop over there that you see.
I have a question.
Yes.
Do they have the same script when they talk every time, or is it different every time you do the simulation?
So the simulators have preset sentences, but we can also speak for the simulator,
Okay.
and we can also speak through the room speakers. So we have different ways, yes, to communicate.
I have a question. So if you answer in a way that doesn't properly make the patient feel good, calm, will it affect their heart rate and things like that, or is
Yeah, so we can modify the vital signs as needed through the simulation. Yes.
So right now that's accurate, right?
Yes. Yes. We can make him have higher temperature if needed. If he was a post-out patient, and if the learning objective was to see if the students identify any changes and how to address maybe a patient with a post-op infection, for example. If that was one of the learning objectives, then the faculty would go ahead and increase the temperature and see if the students pick on that and assess what would be the next best steps. So we want this to be a safe environment for the students to learn. We see mistakes as learning opportunities. So if you don't know how to address a situation, we're happy that happened here. And the faculty will go over it in the debriefing room with you and clarify, and then come back and try it.
I don't like needles.
It's important for us that you as healthcare professionals build confidence, and you only learn that through experience. So we want you to feel nervous, it's okay, it's human. You just have to go through multiple tries, and that will help you build that confidence. Or don't move anything, and be careful that there are sharps, okay? So it adds to the realism, to experience. We want the students to be able to think on their feet under pressure. It's a totally different experience to give an exam, sitting on a desk, on a piece of paper, than actually participating on your feet, going through the situation, the emergency, upset, maybe you're screaming, and you still have to make an important decision for the patient that is life or death. So there's no other professionals like the ones we have in the healthcare industry that need to still be able to keep people calm
I'm guessing they are, yes.
My my uncle did this. He did operations.
Yes, he was
He
a
reti-
surgeon.
Yeah, he was a
Yeah.
doctor and a surgeon.
Perfect. So this is for the technicians that assist the surgeon.
Yeah, he retired now, but he was a surgeon.
Nice.
So he went to Argentina to study, and now he retired. But he was a surgeon.
That's amazing.
And my cousin, my older cousin in Peru, because I'm in Peru, she's a nurse. So,
Wow, that's nice. All your family.
and I want to be a vet tech.
Yes. All your family is in the healthcare industry then.
Yeah.
That's wonderful.
Most of my cousins are teachers. One is like a lawyer. One of them was like a police, like a psychologist, police.
So you guys all want to help. You always like to help people or just help. That's beautiful.
Yeah, I want to help animals and save lives. So there's nobody in my family that's in vet tech, so I want to be in vet
The
tech.
first one. in
Because
your
I love
family.
animals.
That's beautiful.
And I have a little dog.
You have a little dog.
Yeah.
All right. So you're welcome. Let's move on, please, to the next. This is where you get people forming
Alright guys, let's go Glover.
One boomerang here, okay? I tell you one, okay? Just do a move, any movement. I'm gonna get closer. 1, 2, 3. Perfect. Thank
Wait for me here. I'm gonna make sure the professor's right.
Just find a chair, take a chair. There's no more
Guys, I promise you these are the nicest people on campus. Yeah, tough but nice.
That's too bad, you're not here. I know. Okay, let me turn off music because they say music, I think you should have, I don't know, something like that. Viste, ya, ¿quién fue? Por allá. Okay. You know, I bet if I was playing rap music, you all know what I'm talking about. Of course, I also listen to Metallica and all of that. Anybody? Yo, okay. Okay. Sorry, I do. Really, you want to take my picture? I'm gonna start. Okay. So, welcome to medical campus. I'm sorry, I'm still wearing gloves. It's just because I'm decorating for Halloween. Ah, verdad, que cute. Okay, let me explain about me and Halloween. The only thing they won't allow me is to have body parts out. I do have body parts. Which how many of you want to see? Nobody, good. They're like, nah, wait a minute, we put our hands up, don't play. Okay, so welcome to medical campus. I'm Professor Caridad Gutierrez, my colleague, Professor Magdalena Ransom. I gotta put the Ram-Man. Ram-Man would kill me if I was there. So we do a collaboration. Okay. Professor Lewis is going to speak about nuclear med first, and then I'll speak about pistol technology. The lab you're in is the pistol technology. And why we do this collaboration? Because it's important for you guys as future medical professionals to understand how in the medical world, we're not in silence. We all know. Okay? Take it away from us. I'm sorry. Let me go over here.
How we doing this morning? Okay, so my name is Dr. Lewis, and I am the program director for nuclear medicine. Does anybody know what that is? Does anybody? So when you hear the word nuclear, what comes to mind? Huh? I like that. Hello, that's usually what we get, the bombs. Right? Like, okay, you building bombs? Yeah, I'm building bombs in the hospital. Right? That's what it is. But nuclear medicine.
I have it.
Okay. Is where we use radiation. We inject it. You can ingest it. You can inhale it, and we treat and detect things from something as simple as your gallbladder needs to be removed, something as complicated as your tumor is growing and we need to increase your heat. So it can be very simplistic. It can be very complicated. So this is what nuclear medicine is. We are housed in imaging. So we're part of radiology, X-ray, CT, MRI. Nuke Med is the redheaded stepchild, right? Additionally, because of the word nuclear, we've actually moved away from nuclear and call it molecular imaging. It sounds fancy and less scary, right? So this is what a nuclear medicine camera looks like. The difference in nuclear medicine and every other imaging modality is that we do not, this camera is useless if you don't get the radiation inside. So basically, if we don't adjust or give the right radiation to go to the right part of the body, this is a paperweight. It's useless, right? So this is basically a radiation detector, and we're taught how to work this, QC it, the whole kit and caboodle. Next. All right, so where do nuke med techs work? We work in imaging centers, hospitals. We do a lot of research. There's a lot of research for people on death row, and they say like they have frontal lobe issues, so we do a lot of brain imaging. And then of course there's teaching. Somebody got to come get my job. Okay, I'm retiring, and somebody has to come get my job. So I welcome any of you to please come get my job, right? So we work in physician offices. So the baseline for this is an associate's degree. So when you come out of here, you could start making your money. But if you want to keep going to school,
Everybody applaud.
if you want to keep going to school, you could be a director. You could be a director. I have cross-trained into other imaging just for fun. Like, you know, I could work on nuke med Monday to Friday, MRI, Saturday, Sunday. You know, get a little money on the side. All right. Get money. Money is important. Hello. But patients don't by themselves. Next. Listen, that's what we're thinking. Okay, so the job outlook. We cannot talk about jobs without talking about what's in it for me, right? Because ain't nobody trying to work for free. Correct? So according to the Bureau of Labor Statistics, the annual wage for nuclear med technologists was $80,000 per year back in May 2020. So this may have changed because a lot of people retired because COVID was scary. A lot of old people who used to come to work and be like, I'm not gonna do too much, but I'm making my good money. They were like, deuces, gots to go. And so we have like a significant shortage. So they're calling me and be like, I need some texts to come such and such. I get like daily texts like, are you willing to come to Alabama? Are you willing to come to California? I'm like, I'm good, man. Right? So, and a common work day can start as early as 5 a.m. And we do take calls. Everybody know what a beeper is? Y'all know what beepers are? Y'all doing great. They hand you a beeper.
Somebody said beeper?
I know, right? Yeah, I'll ask them. No, they said, I remember those codes. No, but I mean, the young people, you know, they're like, beeper. What is that mean? So they hand you a beeper and they pay you to sleep until the beeper goes off and you gotta go in and sit on it, right? So we do have call. So the typical work day can be something as simple as 8 to 5. But then my hand your beeper and say, go home, don't drink, don't party, don't take your cold medicine because that might be DUI. And if this beeper goes off, come back. So they have to pay you for all of that. You know, not the sleep, sobriety, and not going to club, right? I feel the same. Next. Hello, that's the fun part. All right, so my program strengths, I have clinical sites as far down as Homestead and as far up as Miami Lakes. So we are spread all over this county for people who kind of go everywhere. Additionally, we have hospitals and outpatient centers. So you get a little bit of everything. My clinical internship is 4 semesters. And so you go Monday, Wednesday, Friday, 8 hours a day. It's basically a lot of OJT, because that's you have to do clinical rotations. There's no way around it. That's your hands-on. That's how you get your competencies. That is how you actually become eligible to sit for those boards that get you that 80 grand. Okay? And my strength, I'm fabulous. That is my strength. Okay, next.
Oh, I'm sorry.
Yes, please.
They were motioning to me.
They were like, she's not as fabulous as she is. Okay, so associates in science, that's what I teach. Time to completion is 5 semesters. From the time you start to the time you finish is 5 semesters. I count my things as semesters, because semesters mean tuition. General ed, so you have to have your English, you have to have your anatomy and physiology, chemistry, Math 1105, and physics. You have to have those before you come. It's nuclear medicine. There's also a pharmacy aspect to it, where we learn how to mix radiation and make the medicines, and then what goes behind it, right? Deadline is May 1st, and we take a cohort every year. Our cohort maxes out at 16. So we already talked about this certification. So you're eligible for your, I actually have my students paying for their boards this semester, so they can schedule it the day after they're finished with us. So you finish on Friday, Saturday, you go, you get your boards done. I need you to know that I'm in my feelings when I don't get eye contact. I'm an only daughter, okay? And I totally need attention. Hello. So I'm gonna need you to give me just a little bit of attention. Oh, you've been looking at me. I'm thinking, I have issues. All right.
She does. We both have issues. Mine are worse.
Additional graduates. So a lot of times we have students, so there are a lot of scholarships. Baptist has a scholarship for new med techs where they help you pay and then you guarantee the job with them. So Baptist will help you pay. They're called Baptist scholars. Additionally, the board has a specific scholarship for medical campus students. That if you want to get a bachelor's after you finish here, they'll pay for it. And I always recommend a bachelor's in business, because to be a director, you got to have a little business acumen, you know, MBA, CEO type of thing. I would love to say I have a student that's a CEO, so please come make my dreams come true. Okay, next. Okay, so that is the number to get information. So the reason I go first, not because I'm more important, but because I diagnose. So in my field, we diagnose and we find the tumors, and we tell the doctors, hey, this has to be removed, that has to be removed, this has to be biopsy. Whatever I find and is removed or biopsy has to go to histotechnology. Okay? So that's why we work together, because historically, because we are the gold standard for cancer. We're in every cancer center. We usually have a lot of tumors removed, biopsies, and anything that we find, discover, and say, okay, this isn't right, goes to histotechnology. So this is why I go first. Not because I'm more important, but because historically I have to find it, or imaging, or somebody has to find it, and then histotechnology are like the scavengers. They're like, bring it on. We got it. Okay?
Did you just call me a scavenger in my face? Meet me
But don't do
outside.
anything. Listen, I can't fight.
I know.
I can't fight.
And I have blades.
So I have a Okay, so like I said, we work together, and that's why usually I go first, so you can see, hey, one thing usually leads to the next. So we have to be a team when we're in the hospital setting. Xavier has any information you may need from me, and I would love for you guys to be part of my next cohort. Please apply. Thank you.
Of course, we saw each other, you know, when we were with Baby, with Gabriela. Yeah, is that? There were, is Anne here? Hi, Anne. I'm a celebrity.
Well, I can't do some of my jokes if they're under 21. No, all adults is fine. You know, we're gonna have to check you out. Okay, so as Professor Lewis said, this is the histotechnology. We are part of the hospital no It's always mushy. So you know, it's mushy, and sometimes it has little things on it. We're like, what's your name? Janine? This is Janine's placenta. That's what I do. And then they call my doctor, and they're like, she's off the meds. You need to come down. And then, you know, they come in and introduce you. But I digress. So we're the part of the lab nobody knows about because everybody knows about blood and body fluids, right? You know, somebody takes your blood, somebody takes your urine, you know, you get stopped for a DUI and you decide, well, I'm not gonna do this, and they arrest you, and then you go in and they go pee in this. I'm sorry, that was just my part. I digress. But, you know, that's a lab, right? Well, we're that other lab. How many of you like Dexter? Okay? Okay, I want you to imagine, those who have watched Dexter, you know how crazy he is if they have it, right? Who would be crazy? Dexter is my boss, but I'm the one that works behind him. Would it be him, or do I really need my meds? How many think I need my meds? It's okay, my children tell me this all the time. You believe that. Okay, so with histotechnology, all the instruments you see here, my students usually get shocked because as soon as they come in, they start cutting human tissue. No, we do not go to Sedano, Presidente, Winn-Dixie, or Publix and say, I need a slab of meat. No. We cut human body. How many of you are really getting into medicine? What? Only 2? How many of you, mommy said you had to be a doctor?
Me.
Okay. A nurse? Okay, you know, this is a little thing you should know. It's part of medicine. Woo! That's why you guys are visiting the medical campus. Okay, most of my nursing students, when I start telling them about body parts, how many of you want to become OR nurses? Make lots of money. Okay? They're like, what? Wait a minute. I always ask this question from nursing people. Why? When you are in nursing, cutting up the body part with the surgeon, and you have to bring it to me, why do you go, ew, there's a body part that needs to be brought to me? Right? Weren't you in there cutting it off the patient? So that's what we do. We get your body parts. And when I mean body parts, I mean anything that comes out of my human body. We have jokes in my lab. Yeah, there we go. We have the salad joke. I have an instrument that you don't need to have in your body because there are people who have certain physical practices. Look, he's already laughing over there like, no, she's not. Yes, there are certain people like certain practices that include organically grown avocados, carrots, which are usually very large, and they in certain orifices in their bodies. Guess who gets that? When that insertion is done incorrectly and then perforates. So this is where we make jokes about salads. And I'm kind of quite vegetarian, so I'm calling it offensive for that poor vegetable, okay? You know, we also get anything you put in your body. When you were a kid and you decided, I'm gonna swallow a pin, and then you gotta go to surgery, well, we have to get that pin with whatever it hurt. Because we have to prove that 1, the pin is out, okay, and 2, that it hasn't caused any more damage. And then we get the people who also have other practices that like Coca-Cola bottles. You guys don't know Coca-Cola bottles from when they were glass, when they were plastic ones. They used to be glass. Do not insert glass Coca-Cola bottles in orifice that does not belong. You think I'm kidding? Wow, okay. Okay? My students, when they go to, there are 3 hospitals, one of them which I worked at for years. Yeah, you think it's funny, right? We have repeated offenders. I worked at a hospital for about 10 years. And December is when this offender would always have something else. So we figured that was somebody who was, all joking aside, was part of the sex trade. Okay? So, wow, you guys got quiet real quick. You're like, what the hell? It's okay, my kids tell people all the time, she's on medicine. So where do we work? Well, yes, we will be working in the morning. There is a histotech over there. Okay, why? Because when you bring in a body and the doctor does the dissection, or somebody has to cut all that out, right? So this is why I tell you don't touch the instruments, because those instruments have been exposed to human body parts. Yay! I'm so excited. So what happens? You come in, you start cutting, and you make what is called a surgical block, which are missing from where they're supposed to be. Oh, and I also have a bad habit. You remove something from my lab, I will follow you home and cut you up. Who thinks it's funny? Ask me. This is what a human surgical block looks like. We also do animals. We also do plants. Okay? That is our job. Okay? This is why Professor Lewis explains that she comes first, because when they find a cancer, patient goes to surgery, right? The only one who can tell you what type of cancer it really is my boss, the pathologist. The pathologist does not do the back end. We do. We prepare slides, give the color based on what they're looking for, and with those colors is how they determine what kind of cancer it is. But it's not just cancer. Anybody have their gallbladder in there? Index? Ovaries? Nobody else here have their, didn't you have your ovaries removed? I didn't get you.
I had my prostate removed.
How did you have your prostate
My
removed?
prostrate, not my prostate.
I didn't know she got moving. I'm like, well,
Yeah.
this is why you don't have friends working with you, okay?
Okay.
So anything we remove, all joking aside, we get, okay? Now, we are not gonna make the money that is made from touching patients. How many of you don't wanna touch people? Because I personally, it's okay, honey, because I did not like touching people. You might think, well, she's done this for a lot of years. I have been in medicine since before, many of you before, and I was 14 years old. Because I was one of the few people who could translate Spanish and English at a very early age. I had a special job at JMH. My first translation was to explain to a Spanish speaker that her child had died in Europe. So my ideas of medicine are kind of skewed because I have dealt from the good part of medicine to see what humans do. I actually used to work in blood bank and used to have to visit trauma a lot. This was when JMH was the only trauma unit, and there are some things you see that humans do to each other, and you're like, that's why I don't watch Dexter, or I do watch Game of Thrones because I like dragons. I think dragons should come back and burn the whole place down, but that's just me digress. Look, he's going, yo, I agree, okay, you know? And I did nuclear med, oh, there's something that Professor Lewis forgot to tell you. When you become a nuclear med tech, you do know you have to be registered, right? If anything happens at Turkey Point, they might call you. Yeah, she has a, they have a direct line to her from Turkey Point. I usually call and try to make crack calls and stuff. Professor Lewis screw up something, somebody was get here, what? You know, now you get in trouble, okay? So back in 2020, this is what they said we were making. That's no longer true. What happened 2019 to 2010? Anybody? What happened? What is that? Don't you know 2020 doesn't exist? Did everybody tell him? Why didn't you guys tell him 2020 doesn't? 2020 did not exist. We went from 2019 to 2021. Okay, there's no 2020.
It's
Okay.
a pandemic, not a pandemic.
Exactly. So what happened? During the pandemic, a lot of people in my field actually quit. Because we literally retired in the field. You could be 70-something years old and still be, if you're still able to cut, you will hire. So right now, how many of you like to travel? Nobody, right? Who wants to travel? What is this group? Okay, this group. Can we send them all home? They don't want to talk to me.
They wanna see bodies
And you know,
though.
you
They
just
wanna
have
see
the
bodies,
problem
though.
of being an only child. I
I
was
do
a
have a
child.
problem with
I'm
being
the
an only
middle
child.
child. You all better talk to me. I'm the one my parents would be like, watch her. And if people were like, what do you want me to watch her for? I mean, you know. I mean, okay, so when I was younger, I kind of took the crib and turned it over. It wasn't my fault. It was there. So what if I push my brother down the stairs? ¿Quién le mandó a estar diciendo caridad? Tú eres muy flaca, ¿viste? Down the stairs. Wow, that was a good memory. Ooh, that was fun. Okay, anyway, going back. So basically that's what happened. So right now, I am getting calls. You think it was only in the United States, right? I'm getting calls from around the world. I'm getting emails. When do they graduate? Do they want to travel? We do have this thing called travel distance. You have to have a bachelor's degree in one. Guess what? We just opened up a bachelor's degree program in histotechnology. So when you finish this program and you get your state license, because you do have to be certified, and you get your bachelor's degree and do the other certification, now you are an international tech. Where are my clinical sites? Unlike some other programs here, I can go all the way, let's see, the furthest I've gone is Palm Beach County, all the way down to the Keys. Because except for, I won't go all the way up to Jacksonville, because that is my sister program in Jacksonville. But we are the only two state programs. So we can send you anywhere you want. And please go anywhere, because I'd like to like leave Miami once in a while and tell them, listen, I gotta visit a student in Hawaii. And you know, I need to take, they won't send me that. I could try. We do a lot of collaborations with a lot of different things. We're trying to collaborate with AI. This instrument you see here is an AI. Why? Wouldn't you wonder, what did the doctors do with the patients that were in the hospital that needed surgery, but they couldn't be inside the hospital? Well, they did digital microscopy. Literally, this machine, I can put a microscope slide on it and set it to your phone, your computer, wherever you want it, so the doctor can read it. So that's what we do. And now we're trying to collaborate with a company in Spain to see if we can have our students learn how to use their robotic instruments. I'm always looking for the next thing. Because once you have something, whatever you're gonna study, if they say, hey, we have this new certificate, get it. Become more market. You make more money. Because you guys don't want to make money. Nobody wants to make money. You want to sit at home. I like to sit at home. Okay, so any questions about any of the programs? So this group is gonna be the first group coming like that. You will not touch, you will, anybody have allergies to formaldehyde? Anybody have allergies or anything that could cause them to go into anaphylactic shock if they smell strong things? I need to know, because you better have your EpiPen. If you don't have your EpiPen, you cannot come. And I didn't bring an extra EpiPen, and that might not have what you need. It might have something else. I mean, you know, like I said, you know, I turn the kids over. Okay, this week, and then I'm really going to start. Don't feel afraid.
We love your class.
Yeah.
When you look at the tissue, is it always for like cancer or sickness related or?
No,
research?
sometimes, remember what I told you, we'll get something that's perforated?
Mhm.
Sometimes it's stuff like that. Or sometimes you are born with a condition, okay, a physical condition that warrants a biopsy to see if it's something that is gonna hurt you later on. So sometimes we just get biopsies, Okay, it's not always, a lot of times people think, oh, histotechnology only deals with cancer. No, we deal with whatever comes out of your body. Take, for instance, if this young lady's little thing right here decided to become infected and they wanted to make sure the infection wasn't spreading and they needed a biopsy, it would come to us.
Oh.
So she knows to keep that clean. How much did that hurt? The one on the chest?
Like 8 out of 10 pain.
Oh, that's not bad.
Do you have any animals?
What do you do after you do everything?
After we do everything?
Hello, hello.
Professor.
Hello.
Good morning.
Uma casa,
Let me see what they tell me. Okay, I'll let you know.
Okay, so hello everybody. Hello. So where you coming from? From where? Kennecato. That's a far away. It's a nice campus. It has a sport room, it has a nice basketball, and it has a pool too, right? Yeah, that's nice. We have none of that here. But we have Midtown. Yeah, we have Bayside, we have the Booster Campus, right? Here's the good stuff. It's too far from the good stuff. Yeah. So we are a very good and a very specialized campus. Yeah. And basically you already know that this is the medical campus, and that's where all the medical programs are. Okay? How many visits do you have? This is the second visit? Then, huh? This, yeah, but today we carried out and now with the lab, right? Yeah? Right? Okay. So this is your second visit. And after this, they're going somewhere else?
From here, taking them to the nursing labs.
To the nursing lab. All right, so we have the privilege to have you first. Yeah, because nursing always wants you guys. All right, no, so now, you're welcome. This is the medical campus, and I'm Professor Mario Toyar. I've been teaching on this campus for the last 30 years, before you were born, right? And then, this is, teach for the clinical laboratory science. Also, I'm the clinical coordinator for the students when they place them into going to clinicals. So, I have a big responsibility, but I enjoy very much the job, okay? Now, in the clinical laboratory science, it's sad somehow that nobody really advertised too much about us, but actually the clinical laboratory scientist is actually the main power for clinical diagnosis, meaning that no doctor can make a precise treatment without us. No nurse can inject insulin to the patient without us. No hematologist can know if the patient needs transfusions without us. No doctor can prescribe an antibiotic without us. No medication can be given or any further treatment on the patient or invasive procedure without results, correct? So meaning that once we give the word, the doctor makes decision, correct? That's what it is, and that's what the clinical lab is. So maybe when you go to the movies and enjoy the movie very much, then you always people that work very hard for that movie to come out. So we work behind the scene. And the last people to carry any treatment on a patient is the lab. We never appear, not even in the small letters, anywhere in the report. But without us, nobody can do anything, correct? Okay, yes. So it's a very good profession. It's not because I'm telling you so because I'm teaching on campus, I'm building my career. No. I graduated from this campus in 1985, and I worked 31 years in the hospital, which I retired from. And then I also came out to teach on campus. It's a very stable position. If you're thinking in a career where you don't have much patient contact and family drama, this is the profession. Because yes, because you know, nurses, physical therapy, respiratory, you have to deal with patients. You know, some people have the heart to deal with that, some people don't. We work in the lab very independently, very well supervised, but independently, meaning that you have contact with family, patients, and anything else. The only thing we do is just to have contact with the patient specimens. And that's basically body fluids, blood, urine, stools. And then you do testing such as direct testing, such as complete blood count, and also probably you have talked about, you have taken anatomy, physiology, or regular microbiology. You've been exposed to the world of some part of the medical microbiology. So just we do, the profession is very stable. In my time, the starting salary was $14 an hour. It was a lot in 1996. Nowadays, it's starting at $35, $45 an hour. Now, with the crisis of what happened with the coronavirus, there were companies paying up to $80 to $90 an hour to do COVID-19. And then now you know that the molecular testing is being increasing. And basically, the molecular testing is taking over the traditional testing in the lab. So this is something that the clinical laboratory sciences is an outgrowing or always changing career. So that means that you're always exposed to new technology, you're exposed to top of the line, incremental of new addition into what you learn on the basic structures on the program of this kind. The program now has an associate degree, and you can continue a bachelor's degree afterwards. We already started the program, we launched the program in the last fall, and we now enrolled the second group for this year, all of these times. So you can do the associate and the associate that it takes 18 months, and then for another year or so, a year and 2 or a year and 5 semesters more, and then you do the bachelor's degree. And you can do it with us, it's all online. When you do the associate degree with us here on campus, you do the lecture and the lab components physically, face to face, and then after the first 5 semesters, go to the clinical site to practice for 4 months, each area of the lab, the laboratories, and then once you complete the program, you can sit for the board exam, which will make you a specialty in 6 areas: hematology, chemistry, immunology, serology, blood bank, microbiology, molecular. So when you get the license, you get a specialized 6 licenses. So one license gives you license for 6 different specialties in the lab. Most of the time, the students, when they go through the program and they do the internship in the hospital, they identify themselves to like better more hematology, or chemistry, or microbiology, or blood bank, and then you become a specialized in that. Okay? But I'll tell you that it takes about 8 months to complete it. That's also now. The bachelor, once you complete the associate with a clinical component, those credits are taken into the bachelor, and you don't have to come on campus. The bachelor component of the program is all online. It's all online. So you can do it online. So let's say that you finish the program, you get your license, you start working, and then you can make online the program without coming back. I believe that you only have to come to the back to the campus just to take the final exam for each term. Basically, the classes for the classes for the bachelor, besides that are online, are all 8 weeks left. so you finish faster. Then you have more lab component because you already took those labs in that source. This group here is the microbiology department. This is the microbiology classes. Actually, you have the two main powers of identification of bacteria. And this instrument here is what is the market. Any hospital you go, they will have this. Just purchase this. So we have technology incorporated up-to-date technology that the workflow along with the hospital. So when you see classes, it's exactly like you can be exposed in the hospital. So you get to the hospital, you know what's going on. You remember those times when we don't have much technology on campus? The campus, the college, they spend a lot of money on technology. So we keep you providing the up to date skills that you need to compete out there when you finish the program. So if you're really interested to make an impact in people's life, the clinical laboratory science, it is. It's a very accurate and precise department, so it's not really as easy as you think. It's a lot of information. It's a lot of material for you to understand and go through, but it's a very, very, very rewarding. It's very, very rewarding program. Why? If the patient is picked up at home because he faint and the rescue comes, unless that blood goes to the lab, that's analyzed, nobody was wrong, nobody knows what wrong with the patient. So nobody can do anything on the patient, touch the patient, until the lab is solved and released. And that's what we're here for. Now, sometimes when you go to parties and you go out there, you go to social events and they ask you, what do you work at? What do you work at? How do you work in the clinical lab? Oh, so you're a vampire, because the concept is that the only thing we do is to draw blood. Now, the phlebotomy is now a profession that we have also a program here. We want to teach safety to that. But the clinical laboratory science is a complete, very well organized, structured entity. It's a lot of opportunities for placement and employment for students and students. So I welcome you to the medical campus. Just consider the fact that if you apply for a program that might not take you, but if you're interested to be a good researcher, to know what I'm guessing, because without result from the lab, the doctor is guessing. The doctor has an idea, but when you faint, it could be a heart attack, it could be a stroke, a hypoglycemia, or you have a diabetic coma. How do you know that? Who differentiates all of those? The lab. Who gets the credit? Doctors. That's what it is. That's what it is. That's what it is. If I faint now and they come to the rescue, who knows? I could be hypoglycemic, which I am. I could have a stroke. I could have had a heart attack, massive heart attack. I'm fine. Now, when the rescue comes, take the sample, send to the lab say, oh, the glucose was 65, so they know they have to give me what? Glucose, dextrose, and iodine. Oh, but the blood sugar is 565. Oh, okay, so it's 565, so we have to give him insulin. Oh, but the patient has a stroke. Oh, we have to give him the TPN to break the stroke. Then the patient can be able to come back to normal. Or the patient had a heart attack, then they have to do catheterization or the heart surgery. Who determines that? The patient is recovering from a heart attack. The patient is recovering from a stroke. The patient is recovering from the diabetic coma. They put insulin. They have to do another sample, send it to the lab, and to see if the blood sugar came down. The doctor can never cares if the blood sugar is still high, if it came down, if the patient needs more insulin, if it needs more treatment. Nobody can guess that unless they accurate and precise stuff will be clinical laboratory science into the medical field. So I just wanted you to know that no, it's not for applause, it's just, I don't do this for, but I'm just telling you, so besides that you have a beautiful technology out there, we lack a lot of communication and information. Because nobody tells you, nobody broadcasts this anywhere on TV. So unless you guys come, so I really appreciate that you took the time and actually came from the Kendall campus to research on your own. Because I don't think anybody have told you before what we do here in the lab. I don't think you've been exposed to that. So even though we have TVs and we have laptops and tablets and cell phone, communication is very important. And being information is very important. And this first step that you took is very, very important. The medical field is very stable in any avenue you go. Any program you take on campus is a very good program. The medical campus is solid and strong. We produce good professionals, and we put good professionals out there, and I'm very proud of that. But what I'm telling you is that if for any reason you compete in another program, I just want you to keep in mind that it's not only nursing, it's not only physician assistant, that people always trying to follow. Have good programs on campus that can make you successful and financially stable for the rest of your life. Okay? So, welcome. Wish you good luck, and I hope to see some of you in the program. I'm nice, but I'm not good. That's what people say. I always smile, but if you don't know what you do, problem, right?
Why did you say call her mom? Why did the other teacher say call her mom?
What is the other one?
Why did the other teacher say call her mom?
Oh. I'm talking.
That's what the other teacher was saying.
Oh, yeah, I'm popular. Okay, well, I'm popular. Well, I'm popular maybe because I've been in school long, 30 years, maybe. Papa? Well, that's what Caridad said. Oh, yeah. Well, Caridad and I have been together for more than 30 years. She used to work at the hospital with me, and then we came here. Actually, I came here before she did. Yeah, that's him. So you're gonna come to me for the floor. That's what you're trying to say. Yeah? So you're coming with Papa. Don't go with Mama. Mama's harder now. Anyway, guys, so thank you for coming. Thank you for your visit. I appreciate it, and I hope that maybe one day I see you.
Well, do you want to wait here?
Yeah, I'll probably wait here.
Yeah.
Thank you.
You're welcome. We're going to be downside into the hall on the right.
Okay.
Come on in, have a seat.
You guys are now
I guess. Go ahead, do whatever you want. I told you.
Hello, my name is Dr. Michelle Lee. I am the director of the respiratory care program. I'm a nurse and a respiratory therapist. I've been in healthcare for a little over 20 years. I love it. I think it's great. Respiratory, lots of people don't know about respiratory, and respiratory didn't kind of come on the mainstream whatever until COVID. And now lots more people know about respiratory care. But we're basically like specialists for the heart and lungs. We have the same amount of education as kind of a nurse does, same 5 semesters. You come out, this program comes out with an associate's degree. I also have a bachelor's in respiratory, in cardiopulmonary care, and a master's in cardiopulmonary care. So you can go a lot further. Ohio just opened an advanced practice school, so they have kind of like a nurse practitioner level for respiratory care now. It's kind of up and coming. Florida doesn't quite have it yet, but it's on the forefront. Respiratory is just amazing. If you're interested or you know anybody that is, or you have any questions, we take care of people who can't breathe for whatever reason, whether it be, you know, a trauma and they can't maintain their airway, to stroke patients, to kids with asthma, preterm infants, everything. So this program, once you come out, you're ready to practice. You are actually competent to work in an ICU, to take arterial blood. You don't have to do, like with nursing, once you come out of nursing, you have to do pretty much an internship somewhere for sometimes up to a year or so. They kind of partner you with somebody and you're not really on your own. With respiratory, once our students graduate, they're ready to go. It's just, they can work in the ICUs, they can do anything. We do about 200 to 400 clinical hours a semester. So they're working alongside respiratory therapists the whole time they're in school, so whenever they come out, they're ready to go. These guys that you see in blue are respiratory students. They're just on their break today between classes. Any questions?
How long is the program?
The program's 5 semesters. We have an application deadline of May 1st every year, and we start classes in August of every year. So it's 5 semesters, kind of the same prerequisites as nursing or whatever. So I gave you the pamphlet about it if you have any questions. There's also a couple QR codes there that link to, there's a site called morerts.com because there's a national push, because there's a shortage everywhere of respiratory therapists. I think Jackson Memorial has like 75 openings, Baptist has like 60 something openings. Everybody is dying for respiratory therapists, especially since COVID. Before, there was a lot of job openings. Now they're just really hurting for respiratory therapists everywhere. So there's a site called morerts.com. I put a QR code on there for you. If you have questions, it has videos of what an RT does, what a day in the life of an RT is, kind of ways to find educational opportunities, schools, things like that. I thought it might help. And maybe you're not interested today, but maybe as you go along, you are, or maybe you know somebody that is looking for their niche in healthcare. Respiratory is a lot more team-based than nursing. We work together to solve problems a lot more than other allied health or nursing fields. So, Professor Slocum, am I missing anything?
You want me to address the diagnostic stuff?
Sure.
And I'm only gonna do that because, that's a part of respiratory care that, I was fortunate enough to be in. And, Dr. Lee just explained, there's the therapeutic side of our profession where we treat, cardiopulmonary diseases, bronchitis, emphysema, asthma. We also work in the critical care areas where we deal with trauma, things that might cause people to stop breathing, gunshot wounds, traffic accidents, falls, things like that. And we basically manage the machines that breathe for these people in critical care. So that's what she was describing to you. But there is another side of respiratory that people don't see sometimes, and that's the diagnostic areas where we're actually testing patients for lung disease. And so that's called pulmonary function testing, where we actually, will measure the volume of the gas that comes out of your lungs, the concentrations, the flow, and we can tell this person has asthma or bronchitis or emphysema, or they have some other kind of lung disease. So there's diagnostic aspects. Those jobs are great because they're Monday through Friday, 7 to 3 kind of things. You don't like those 12-hour, shifts. But we also have pulmonary rehabilitation, where we teach people with severe lung disease who can't do very much for themselves anymore. We teach them how to take their medications, how to take care of themselves, how to exercise so that they can live more normal lives instead of being so crippled and in their beds. But there's another thing too, that we do, and that's, this is diagnostic. Respiratory therapists segue into what's called polysomnography. Have any of you ever heard of that, polysomnography? It's sleep diagnostics. We actually work in sleep centers where we're monitoring primarily, but not specifically, how patients are breathing while they sleep. Because you ever heard grandpa snore and stop breathing once in a while? Right? He has sleep apnea. Apnea means to stop breathing, and so we monitor that, and we monitor how that's affecting their sleep, how it's affecting their breathing, and then we help resolve that. So respiratory therapists do that. And then we also do another diagnostic procedure. It's called, we assist physicians with bronchoscopies. Those are fiber optic examinations of the lung. And so we work hand in hand with physicians to assist them with these patients, examine lungs, take tissue samples of tumors, or clean out lungs that are infected and things like that. So not only do we do what Miss Lee was talking about, or Dr. Lee was talking about, the therapeutic side, but we also have a diagnostic side. And it could get even more interesting. We have therapists who transport patients all over the world in jets. They get on a jet, they have a little baby, they're gonna transport them from here to the islands or from here to Europe. And so we're part sometimes of a flight team that takes people who travel around that have primary respiratory problems. Did I forget anything, Dr. Lee?
No, you got a lot of the things I missed. Yeah, you know, even transport via helicopter, you see the helicopter, the medevac flying, you know, and we have respiratory therapists that run those. Sometimes, you know, you're an American citizen and you're 6 months pregnant and you're good to travel for a few more months, and things happen, and so your baby is over there, we go get them and help bring them home if they're having breathing problems because they're born early or whatever. There's a lot. It's very versatile. You'll never see the same thing twice in a day, it feels like. There's just a lot of interesting things. Whereas nursing, you're stuck with the same 3 or the same 7 patients all day. Respiratory is all over, and you get to see a lot more stuff. Any questions? Yeah. He wants the body box.
That's called a body plethysmograph, and we measure lung volumes in a very special way. I can tell, put you in that box and take some measurements, I can tell how large your lungs are. And because there's normal values for you, and your lungs could be very small because of a disease, a pathology, and I'd be able to see that from testing done in that box. That's part of our diagnostic work. Yeah, good.
We have a lot of very cool toys in here. These mannequins that you see, all of them were at least 50,000. That kid that's there was 100,000. We have an infant back there in the isolette. She is about 100,000. She can do everything, like cry. She can, I don't know if you've ever felt a baby's soft spot. She has a soft spot that can bulge, that can sink in. You can feel her pulses all over. She moves her arms, her legs, has all of these guys, well, most of these guys have pulses. They breathe, they can talk, they can speak like 6 languages. You can do all kinds of procedures on them. They have the airway like you have. We can hook them up on ventilators. They will trigger the ventilator and breathe like a real person. So that by the time our students get out to real people, they've been able to run these things so many times that they're comfortable with what they're doing. And we're comfortable knowing what they're doing. That's why they can go straight into the field and be competent.
Upon completing the program, what's like the average starting salary for after?
It really depends on where you want to go and what you want to do. And COVID changed the game, man. I saw some, I think the highest sign-on bonus I've seen for respiratory was $45,000 somewhere in Texas. You can make a lot of money, or you can make, you know, mid-20s per hour. It just kind of depends on what you want to do and where you want to go. I answer that is that about your assessment of it?
I think so. I think the average salary after graduating and starting is like $65,000 a year, maybe $70,000 in this area here. So it's not bad. A 2-year associate's in science degree, but it's not easy.
That's for 3 days a week.
It's not easy. The program and it is arduous. It's difficult, but we're not learning to make pizzas here. You know, we're learning to take care of premature babies that can't breathe for themselves, to people who have been in terrible accidents or things like that who can't breathe for themselves. So it's arduous, but it's super important. What we do is super important. There's a great demand, and the pay is not bad. And what Dr. Lee was saying, COVID changed anything. There's people that travel the United States as respiratory therapists to go to hospitals that are in real need, and they're paying $100 an hour. Not too
I saw a job
shabby.
posting yesterday from Pennsylvania for $8,700 a week. That's 512s. That's a lot of work. Like they're earning that money. Don't get me wrong, but that's still a lot of money.
Not bad. You could pay your bills with that. Might even have a night out now and then with that kind of money, right? Yeah.
Respiratory is a fun career. I think I love it. You know, I went through nursing and I just stuck with respiratory. I just like it. I think it's specialized and you're really good at what you do. Questions? Thoughts? How many of you have ever heard a respiratory therapist before you were? Yeah? A few? Because of a hospital experience, like because of a professional experience, or because you have family?
Family, my mom's friend is,
Nice. Most people only know because of either you found out the nurse that you thought was taking care of you was really a respiratory therapist, or you have somebody that you know personally. Generally, you know, Johnson & Johnson does not make commercials about us. We're the unsung heroes. What else? Anything? Well, thanks for coming. Can I take a picture for our Instagram page?
Thank you.
Let's see if I can get. All right. Smile. Let me find our name, and I'll tell you where to find it if you want. I'm glad you were running late.
Because you're dealing with a lot of things, needles, glasses. We want to make sure that you don't get cut or get stuck with a needle. This is where you learn how to assess a patient from head to toe, right? Recognize the patient, look for signs and symptoms, any abnormalities on the patient, okay? This is where, when you look at patients, you say, oh, these patients are doing good, right? As nurses, what we do when we walk inside the room, the first thing we look at the patient. Oh, my patient is not doing well, by looking at it, right? That's why you develop on this lab over here, you develop this site, because we inspect, we touch, and we listen, right? By looking at it, by somebody that is walking, their behavior can tell you what's going on through their life. When you assess, you can listen through a stethoscope, you can touch by palpating, and this is what they learn over here. They learn head to toe assessment, okay? Any question? Anybody have a question? None? Anybody interested in nursing that want to have a specific question about nursing?
Can we transfer with an AA from Kendall?
Yes, you can, but remember, nursing has specific prerequisites, right? You may have an AA, but you may miss some prerequisites because of the prerequisites that you may need just for nursing, right? You may do an AA in something, you may not need anatomy too. But for this one, you need anatomy too, right? So you have to look at the prerequisites. I recommend any student that go to your advisor at the campus that you are at Kendall, but also come to the advisors here, because we're more driven to the medical part, right? Kendall, they gonna advise you on general, right? Over here is more specific nursing. Okay, we have one advisor just for nursing. They know anything inside out just for nursing, right? We have an advisor for EMS. We have one advisor for PA. We have one advisor for histology, for medical assistant, for sonography, right? For all of them. So they know specific what it needs to be to get into the program. For dental hygienists, right? They know all the detail about getting into the programs, right? Because in the other campus, they might know the general, what you need, but I recommend that you come to this campus when you need to something specific about medical, all right? Any other question? That's a great question, thank you.
When students are like working in here, are they working with like real people and mannequins or?
Well, we work two ways, right? We work with one student with the other, and we work with mannequins. It depends on you, what you need to do. For example, injection. You know, NG2 putting a tube through the nose, right? You know, you don't. But when it comes to do head to toe assessment, one student doing another student. Okay. And another like vital signs, another student. You know, things like that. But when it comes to putting tubes or putting injection, putting IVs, it's through the mannequins. Yes. All right. Any other question? Good question. Thank you. I'm so happy to see a lot of you. I know. I love you. I love when I see a student coming by, right? Because I was a student once, right? And I'm still going to school now, so I know what is.
I have a question, but it's more personal to you. Are you a nurse educator?
Yes, I'm a nurse educator. I have master nursing education. Yes.
Okay.
It's working on my DNPS now. Yes.
Okay.
You know, education is what's gonna take you, right? It is important. Sometimes we say, "Oh my God." You know, we find a job as a student, right? I was 18 and I find myself a job. I dropped out from high school. I regret that all my life, right? So guess what? One day I wake up, I say, I need to go back. So I did it. So, but please, you know, school is everything, you know. A degree, some people say, a piece of paper, yes, a piece of paper. So I tell my kids, I can take this piece of paper and move anywhere in the United States. I'm still a nurse, right? Without that, you know, I'm not a nurse, but just go for your degree, right? And find something that you're gonna enjoy and something that you're gonna make money, all right? Because you can love it, but if you don't make enough to survive, you're gonna be like, oh my God, what I did, right? Make sure that you get something where you're gonna be happy and you're gonna enjoy it. For you, Washington and Jefferson needs to commence. Yes, right? How you gonna survive without those, right? It's not the most important thing, right? But if you want to become a nurse, I'm happy, but make sure that you really enjoy it. You're gonna make money, not at the beginning. Of course, you're gonna make money, but as you grow as a nurse, okay? Like every position you go in life. You have a question?
Yeah. So you said that if you have your nurse degree, you can go to anywhere. How does that work? Are you supposed to take an exam to?
Well, some state they recognize your license, right?
Okay.
They recognize your states. All the state you have to move and take just a test, right? It depends on the state where you're moving in.
Does Florida's state exam qualify for many states?
Many, I don't know how they call it, but they call it like grandfather in or something like that. That they recognize the license from here and they say, and we recognize all the state licenses, right? Have to be within the United States, right? So, but some states say no, like New York, I know for sure, New York want their own thing, right? So, if you move to New York, guess what? You're gonna have to maybe take a state license, right? But it's just a test, you don't have to, okay? Great question, good. Question like good, I love questions, and a lot of people say, I'm gonna ask you stupid questions. The only stupid question is the one that we don't ask. And then we go home, I should have said this, I should have asked it, yeah. You have nobody to answer it now, right? So I tell my student, please ask any question, right? Because I love questions and I like challenging. What's the best answer when you don't know something? If they ask you a question and you don't know the answer, what you should say?
I don't know.
I don't know. That's the best answer when you don't know something, right? A lot of students, I don't know everything in medical, right? I don't know everything, but if you ask me something that I don't know, I say, I'm sorry, I don't know, we find the answer and we learn together. Because I don't wanna be like giving you a wrong answer, then you'd be like, oh my God, I'm so confused now. Right? That's not my style, I don't wanna do that. Let's move to the lab up front over here. This
A little cold.
Oh my God.
This my lady here has a tattoo. We put a tattoo on this patient. They have different.
It's real hair.
You know,
Look at the hair.
I want to touch the hair. He has no hair. He has eyebrows.
We have 8 rooms like this one. So with different mannequins, so this is what the students learn everything skills-wise, to work with the patients.
Oh, the apple. He had the apple on his throat.
Oh, hell no. She even got eyes.
That's Mr. Gonzalez.
Mr. Gonzalez.
And Mrs. Green is on the side. Miss Green is on the side. You want to take a picture? This is what we have in nursing to offer you. This floor is only for nursing. So there's no the discipline that comes to this floor. It's on the stalls.
It's so slimy.
Right?
Mhm.
Look, they even gave her mold.
Nursing, you go to the hospital, you go to pediatric.
I think if I take a piece off, I take a piece off, that's like $100. I take a mole off, that's like $100. Hey, Kurt, that thing's front glued on.
And the clinic is only 8 students. So 8 students go to one clinical, they have, maybe in the hospital they say, you can bring 3 groups. So another hospital we have. No. Yeah. Example, my one semester you may go to Jackson, another one you may go to Miami Children, another one you may go to a nursing home. Usually the first semester is a nursing home. A code? No, no. We don't have it. Downstairs in the third floor.
Yeah. This is our fabrication lab. So our students here in this lab, they learn how to adjust glasses, repair glasses, fix broken glasses, break glasses, because we do break glasses sometimes by accident. They also learn how to make a pair of glasses. So not only will they give the eye exam to their patients, help them select a frame and the lenses that they need for that frame, but then we can order the lenses and our students can use these machines that are along the side to cut the lenses with the patient's measurements from their face and make a pair of glasses for that patient. And then the patient comes to pick up the glasses and they'll make sure that the glasses fit on them appropriately and talk to them about their new glasses, make sure they can see well. These microscopes that you see on the desk all over, they're called lensometers. And what we use these for is we use these to read prescriptions in lenses. So we could take anyone's glasses that they're wearing and use this machine, this piece of equipment, to determine what their prescription is that they're wearing just from their glasses. So in the state of Florida, you don't actually need an eye exam every time you get glasses. If you're wearing a pair of glasses, you can go into an optical. They can take your prescription from the glasses that you're wearing using a lensometer and duplicate that pair of glasses, okay? What lenses look before they get cut, they're usually around this size, and the thickness is going to depend on, I think I only have plus lenses here, what type of help you need. Some people need help seeing close up, some people need help seeing far away. She's got a huge lens blank down there. So these get cut down to size based on your prescription, okay? Everybody, it's a very personal thing. You know, everybody's prescription's slightly different. There's a lot of different factors that go into it. Everybody's face is structured slightly different, so some things that look good on one person are not going to look good on another. We also fit contact lenses, and that literally is a medical device that you put in your eye. So that is also a very personal thing. Contact lenses are made of different plastics. Not all of our eyes, our body chemistry will work well with all contact lenses. So we shouldn't be out there buying contact lenses for Halloween from the costume shop. That's not a good idea for our eyes. They're not gonna like that. Technically, you need a prescription from a doctor of optometry to get a pair of contacts. So we want to be careful with that because we can do stuff to damage our eyes and our vision, and once it's gone, usually it's not coming back. The eyes are very delicate.
I have a million more things to say, but I know that I'm on a really tight schedule.
Yeah, sorry about that.
But we are here. If you guys have any questions, please feel free to contact us. Like I said, our program is only 2 years long. There's tons of job opportunities. It's in healthcare, but you don't have to deal with any of the sickness and the, ooey gooey stuff. I mean, it's a nice way to help people, and it's very rewarding, and it's low stress, and you can even own your own business if you want to.
Thank you.
Thank you. I'm sorry for talking so quick. That was the quickest tour I've ever given. Thank you guys. Sorry, I tried.